Right now at 11, fear growing tonight as the CDC works to retrace the steps of a Texas man with our nation's first confirmed case of Ebola. Good evening, everyone. I'm Jameson Euler.
And I'm Wendy Ryan. Thanks for joining us. Tonight, we're finding out how local hospitals are preparing for a possible outbreak right here in Tampa Bay.
But first, our Andrew Dowd is taking action for you, finding out from a local expert what you need to know to keep you and your family safe.
Ebola is probably one of the most dangerous viruses on the planet.
Dr. Thomas Yunash says he's not surprised Ebola is now in the United States.
I think the important thing is not really to panic in terms of this. This is something that would be expected to happen. It has happened. It's probably going to happen again. But our healthcare system is prepared to handle this sort of a thing.
Right now, health officials are working to track down anyone who may have come in contact with the Dallas patient. The patient flew to the U.S. from Liberia, arriving on September 20th. Health officials say 4 days later, the patient began showing symptoms. 2 days after that, on the 26th, they sought care, finally being hospitalized Sunday. But Yunash says simply coming in contact or being around the patient would not necessarily spread the disease.
You really have to come in direct contact with an infected person's secretions, bodily fluids, to become infected.
They also have to be showing symptoms of the illness, which are similar to the flu.
Initially, it feels like you have severe muscle weakness and you spike a fever, and then it progresses to vomiting and diarrhea.
While the CDC says they do not believe there are any other cases, they will be keeping a close eye on the people who came in contact with the patient over the next several days.
The real key is getting people when they actually start to get sick and keeping them away from other people as much as possible.
Now, the CDC doesn't believe anyone on the plane is infected because at the time of the flight, the infected patient wasn't showing signs of symptoms. The CDC says the virus is only contagious during the time they're showing symptoms of being ill. We're live in the newsroom. Andrew Dowd, ABC Action News.
Thank you, Andrew. And right now, here are the symptoms to look for. Again, they're flu-like. So we're talking about fever, severe headache, muscle pain, diarrhea, and unexplained bleeding or bruising. According to the CDC, symptoms may appear anywhere from 2 to 21 days after exposure. And we're going in depth tonight, finding out how local hospitals are preparing in case of an Ebola outbreak right here in Tampa Bay. We reached out to Tampa General Hospital, who tells us they already have a plan in place. We're told they purchased special suits, face shields, and gloves for any staff who may treat patients. They also have designated special negative airflow rooms for suspected cases. And there is no cure for Ebola, only an experimental vaccine. So far, the Ebola epidemic in West Africa has killed more than 3,000 people and sickened at least 6,500. We'll be keeping you updated on the Ebola virus, both on air and wherever you go, through our free mobile app. Just head over to ABC Action News now.